Over the last 24 hours, we have identified about 3,279 new cases of COVID-19 and completed about 8,995 tests. Our positivity rate for lab-confirmed cases is 38.8%. There are currently 1,089 people with COVID-19 in hospital, including 104 in the ICU. Our analytics team has been working hard with Alberta Health Services to provide a robust summary of the proportion of new hospital admissions that are due to COVID as compared to admissions because of other causes. We will provide this information on our website later this week, but for the time being, a summary is being included as a part of my weekday Twitter account updates. Our most recent data from new admissions since late last week indicates that 51% of new admissions to non-ICU spaces are due to COVID infection, and 49% are cases where the infection was not determined to be a cause of admission or where it was not possible to determine. For ICU, the percentage of new admissions due to COVID was 74%, and 26% were incidental infections or unclear. This is a different trend than what we have seen with previous variants, and it is due to the much higher transmissibility of Omicron. We're providing this data to inform planning and in alignment with other provinces' reporting. However, it is important to recognize that any COVID-positive admission has an impact on our acute care capacity. We also know how important it is to get our vaccines, not only first and second doses, but whatever additional doses we're eligible for. For a majority of the province, that would include a third dose, but given that immunocompromised individuals do not develop the same levels of immunity after vaccination, we are moving to make fourth doses available to these people. 3 doses is in fact considered to be a primary vaccine series for someone who is immunocompromised in terms of comparing the level of protection to an average person without immunocompromising conditions. Given this, providing a fourth dose to these individuals is equivalent to a third dose for others. It's difficult to say. We know that other jurisdictions have seen, that have been ahead of us with Omicron, have seen their cases peak around 4 to 5 weeks from the start of the surge. When we look at our wastewater data, there are some locations where we are seeing a bit of a lowering of the wastewater concentration of the virus, but other places where we're still seeing a rise. So one thing to keep in mind is that it will be slightly different in different areas of the province, but certainly it's possible that we could be seeing a plateau or kind of reaching that peak within the next several weeks. It's always true with every wave that hospitalizations continue to rise after the peak of cases, and we have not seen that peak of acute care impact. And again, there's no definitive proof that we are currently at the peak, so we do need to continue to watch. And it's also important to remember that half of the cases that happen in a wave happen on the second side of the peak, which means that everything that we do to minimize transmission, whether it's before the peak or immediately after, still matters, and it matters until that transmission has dropped to very low levels. So our actions are important, again, whether or not we reach the peak in the next week or so. My first message to healthcare staff is that I recognize that this is just the latest onslaught in what has been a very, very long series of waves, and that I can only imagine how tired they are, and that this current wave is just adding to an already significant level of fatigue. So I would say how much their efforts are appreciated, but also that that appreciation can only go so far when they are day in and day out having to manage this pressure. I think that the coming weeks will involve increasing burdens on our acute care, because we know that it does take several weeks after a peak of cases to see the peak of impact in our acute care system. So whether it's ICU beds or non-ICU beds, I would say to those who are working in the system on the front line, thank you. And unfortunately, we do need to prepare for this to get worse before it gets better.